Well, thanks everybody. I'm going to get us started. For those of you I haven't met, I'm Billy Shore. I'm the founder and executive chair of Share Our Strength and our No Kid Hungry campaign. And we've, of course, been working with all of you, some for a very long time and some more recently around our response to COVID-19. We're gathering today, and I'm going to ask everybody to introduce themselves in just a moment. But we're here today for a really, what feels to me like a really special conversation with Angelina Jolie, who is the special envoy for the UN's High Commissioner for Refugees and has been involved in humanitarian work. I think, Angelina, you've just on the UN side alone 19 years. So a long and powerful track record of caring about the most vulnerable and those who are suffering in humanitarian crises, and particularly caring about those who don't always have as strong a voice of their own as they need to have, which is the children. That is something that so many of our organizations have in common. Just, Share Our Strength's work over the last 4 to 6 weeks has been to pivot quickly and to support every organization that we can that is working to replace the meals that kids depended on in schools but are no longer getting because the schools are closed. We've made, I think, $7.5 million of grants in the last 3 weeks to about 290 organizations across virtually every state except I think 1 or 2. By tomorrow, we'll do another $2 million in grants. These organizations are doing everything from setting up grab-and-go sites outside of schools to working with nonprofits or food banks or YMCAs or community organizations. So it's really been a remarkable kind of grassroots surge of effort to replace these meals.
You mentioned I've worked for about 20 years with UNHCR and growing up thinking, I want to help the most vulnerable people in the world. I traveled, I saw people work food lines myself to help people in camps, and saw the rations disappearing. And still we have 70 million people displaced, and half are women and children, and the rations are very low. I don't think any camp is where we have rations met by over 50%. So being aware and watching the food go into the hands of a family and see that family try to search that food and what that means. And I knew that there were problems in America. I knew that there was poverty. I could not believe when I realized how many school children in America were dependent on a meal to not go hungry. I was so disgusted that we have gotten to this point as a country, and that we would let the most vulnerable be in such a state and so dependent. I can't imagine what it feels like for those parents, because I know one of the hardest things for people who become refugees is they want to work, they want to sweat and work, make something, and then give it to their children. And so not only are they not able to do that, but in order to feed their children, they have to ask for it. They have to depend on aid. They have to beg for it, and what it does to them as human beings. So this what it does to families, what it does to children, and so I read about everything all of you were doing, and I just wanted to be with you.
I've been in the school food world for about 20 years now. I'm working in Oakland Unified and now in San Francisco. And, before pandemic, working with No Kid Hungry to expand access to meals through the breakfast in the classroom programs and breakfast after the bell. And now with the pandemic issue, we are doing upwards of, since then, we've done 383,000 meals through our grab and go program at 18 schools. We're also doing door-to-door delivery for our children with allergies and also our special ed students. And think about Blue Apron, using our basically Blue Apron boxes for those families. And then we're also working with our community-based organizations as well to help provide some meals for our adults as well in the community.
I'm Catherine D'Amato. I'm the CEO and president of the Greater Boston Food Bank, a little bit different model of the acquirer, store, and distributor of food to about 550 agencies in the eastern part of Massachusetts. So like everybody else, we're seeing enormous surge. It's almost 100% increase in the distribution of food, and children are among many. We do have a very robust emergency meal program through the public school system in Massachusetts, about 1,300 sites actually across the state. So very active, and the low participation. We're trying to match up our pantries along with each one of those sites across the state so that families can access more food and not just their daily, which is great for 0 to 18. And I think that's an example of a huge accomplishment of being able to get the 0 to 18-year-olds to access that food in our school system right now, and then to match up the families. So we're just seeing unprecedented numbers. As I said, our largest distribution was in the month of March, which is not surprising, of about 7 million meals in the month of March alone.
One Spirit was founded back in 2005. Lakota people, in finding their own feet, of becoming self-sufficient, of defeating the poverty in which they were very well known to live in. Certainly, as the stories that Angelina, you have talked about, people who want to do for themselves, they don't want somebody else to come in and do for them. And so we have played that role with them of finding resources, of working as partners with them to, first of all, provide food, but to also find ways for the food to become sustainable, for the food sources to become sustainable. This was for all the years before the pandemic, and during several emergencies out there, we have worked diligently alongside of them to find the resources that they need to provide what their people need. Pine Ridge Reservation is home to about 40,000 people, Lakota Native Americans, and the fear that is there now of the pandemic and what it can do under these circumstances to devastate this population. So our job during the pandemic has been to begin to do as much prevention as we can. Can we stock food up? Can we make masks? Can we, interestingly enough, the one thing besides stocking food that a lot of people don't have access to is cleaning supplies and disinfectants and things that are not provided under the government subsidies. So that they don't have diapers, they don't have toothpaste, they don't have the things that are necessary, or disinfecting, bleach, laundry supplies that will help them prevent the invasion of a virus. And so we've been able to work with people to get that in, as well as the food for the homes and for the kids. You know, there's a lot of probably over 7,000 people a month that get food through us, and more than that now.
I help out with the feeding program for One Spirit here on Pine Ridge. Logistically, it's been real hard because of the vastness of our area, trying to be able to get things to people that live out in rural areas. So we really face a mounting, crisis of anything like this pandemic when it comes in, because we're already down at the bottom. We're already just struggling just to try to maintain. And when something like this comes on, it's even a harder stressor, because now we're competing with not only people on our reservation trying to get stuff here, but also off the reservation.
The manager of the food program, the firewood program, and I also manage the buffalo house so that we could bring back the buffalo to our people, the all natural grass-fed meats to help the immune system, the health of the people. And as this pandemic kind of gets closer and closer, I'm glad we are right now trying to get our people stocked up with buffalo and stuff like that, so that we could have some good healthy meats. And because the stores are starting to get kind of weird here, so but with that, I'll just say I'm thankful and glad to be a part of this phone call here today.
We're a Tri-County anti-hunger network of over 350 members. And due to the COVID coronavirus pandemic, we launched a home delivery meal program called Meals on Wheels for Kids, aiming to serve the children that are transportation disadvantaged and food insecure. And we were able to launch it the first day of the school closure because of No Kid Hungry. and really, we work in partnership with the school districts, working strategically. When folks call our intake line for the Meals on Wheels program, we let them know of other resources in the community. And, if we gather information during the intake process and determine that they're transportation disadvantaged due to either they don't own a car or head of household is disabled and can't safely get them to a school distribution site. So anyway, it's a gap filling program, and we've just been really blessed to help meet the need, and we deliver a week's worth of groceries to the families to try and help them stay in, just like we all are striving to do. And we're also going to be giving them masks and gloves as soon as we get our order in. But yeah, due to COVID, we launched the home delivered meal program for kids, very similar to the senior program, but aiming to reach the kids that have been affected by the school closure specifically.
Just the question about that, about SNAP, if we, maybe people who may be seeing this, or what is SNAP, and how can it be improved, and what is, I know there's, on the table now that we're all asking for it to be improved, but what now during the emergency, and maybe even past the emergency, what are things that have always been a problem?
The SNAP that comes in will last a short time. Not everybody in there may be covered under SNAP or under the commodities. They get a choice of making at times SNAP or of receiving SNAP or commodities, right? This will last a short time. So our food program comes in at a time when these subsidies are running out.
Angelina, the things when you think about policy shifts, so there are a couple really immediate ones. One is, it always strikes me that in an emergency, we can have an emergency SNAP format to quickly do a one sheet, you're in, you're good. But we can't do that in normal life. So one of those is, how do we get to make it less burdensome on the person who is seeking food? I think the second is, how do we raise that minimum to $30? That's another thing that we're trying to move, is how do you move that up so that individuals can have access to more food? And the third is hot food in retailers. So they can't go to a hot food bar and they can't get a roasted chicken, and walk out with it with their SNAP dollars. So we have seen a 300% increase in applications in Massachusetts in the last few weeks. So it is, and among elders, we're seeing 100% increase among their utilization. So it's an absolutely awesome program, like school meals. How do you get to universal school meal? It just doesn't make sense. So some of those things, this may be the opportunity to push those forward.
Yes.
And some of the requests from the legislature, and especially, or the Congress, and especially if there is a fourth round of stimulus, that would be the opportunity where a voice and the advocates could have an impression to move those things at this time when we might not have been able to move them before.
And everybody on the call should know that that's something that Angelina Jolie is actually weighing in on with the letter to the congressional leadership for this next package, which I think will get some attention. So
hopefully
thanks
it
for doing
will.
that.
Yeah, you're welcome.
Can I just share a little bit, just to demonstrate? So within SNAP, there's something called the fourth week famine. And so families typically run out of their food stamp allocation before the end of the month. And so one of the things that we saw in San Francisco is on our second week of meals, which was around the March 20th, we did 41,000 meals that week. And by the following week, which was the end of March, we did 90,000 meals. And so that's how much the spike in need went. And that's because food stamps ran out. And so that's what happens every month. And then you put the pandemic on top of it. That's the increase that we saw. So the number of meals that we served more than doubled for that. And then you put in particular the roadblocks that this administration has put on to food stamps since they've come in. And you think about public charge is one of the things that has happened. and which in particular has impacted our families. So if you are an immigrant and you're trying to go through the legal process of becoming an American citizen, if you are trying to, if you need food stamps and you apply for food stamps, you run the risk of not being able to become a citizen of this country. And that is something the administration went ahead, I believe, and still put into effect. So you cannot get food stamps even in the middle of this pandemic and still try to become a citizen in this country.
I hope people can hear that from you now, that that is different.
Mhm.
And to be aware of what the administration has done and how it's affecting people. And what I'm hearing from you is what you're all seeing, it sounds like to me, and why it's so important for people to be aware of your work and hear about it, is that you shouldn't be, the government, not only from before, should have done enough for you not to be needed, right? That's what we all say in humanitarian fields. We all we all want to not have to do our work, right? We want it to be handled in a way, because it shouldn't be, you shouldn't have to be filling in these gaps. These gaps should not be so wide, especially in this country. But what it sounds like is that as the needs have grown with the pandemic, they're really not being met. And so your work is not only the work you usually do, but it is growing and growing, and you're filling in gaps that are going to be impossible to meet if the government, or probably already impossible in some ways with everything you're up against, to get to everybody, if the government doesn't start making strong changes right now, and especially with all the people who've now lost their job.
This is where philanthropy is helping, to
Yeah.
bridge that gap for, organizations like No Kid that send money, and other local philanthropists. So that's where the money's coming from now.
One of the things that we're very focused on with the No Kid Hungry campaign has always been, how do we figure out whatever barrier exists between a hungry child or family and a healthy meal, and how do we knock that down? One of the kind of commonalities in this conversation is that, by and large, we have the food in this country, but there have been lots of obstacles for people accessing it in ways they need to before COVID, and now even greater obstacles. So one of the things I would just like to invite folks to do, our job at Share Strength has been to generate resources for those of you on the front line. Angelina Jolie's been playing an indispensable role for us in helping us generate resources by raising this awareness. If there's obstacles that you think we should be focusing on, we've talked about SNAP and the importance of changing that, and we'll circulate Angelina Jolie's letter to everybody once that is finalized and sent. But if there's other obstacles that you think we should be focusing on, if there's other ways we could be helping your organizations, please don't hesitate to push us.
I think needs to be looked at is increasing the income limits for SNAP. Florida, it's 200%, I believe, of poverty. And though a lot of people are unemployed, there's still a lot of people that are working and are suffering because, now they're thwarted into a single income family, and, they're struggling, but because they make a little bit of money, they're not eligible for SNAP. So increasing the income limits is just the other thing that I think would help the struggling families, empower them with their own, funds to go and purchase their own food, and also help relieve the burden on the emergency feeding system to help fill the gaps, that's where the families can't go out and buy the food. So if we could just increase the access to SNAP, I think it would just help everybody.
Yeah, it's a great point, Caitlin, and that's something we keep coming back to, because that's the way that families have the most options to make their own choices and what's in the best interest of their families, to have those SNAP resources, as opposed to, being dependent on so much of what we're doing to make sure that we kind of fill those gaps. Angelina, anything else at your end?
No, I mean, I feel like I've just had I feel very fortunate to have a great education from all of you directly from the front line. And I believe this is the beginning of a much longer conversation and working together, and I'm here. So I will, you have so much ahead of you. I know everything. I'll be thinking about you in the months ahead, and I am standing by if I can help. But just a lot of respect and gratitude to all of you. And I'm so happy for all those children that they have you thinking about them and trying to find solutions, and all of those families. I know you really are making such a huge difference to the lives of all of these families, and it's very nice to meet all of you.